Hi, my name is Brett Harrison. Today I'm going to be talking about the awareness and prevention of concussions in youth recreational and competitive hockey. This is to make the players and parents both more aware of the signs and symptoms, and also to make sure that they become more aware of how to prevent concussions before they happen. Concussions are a very severe injury which are also very reoccurring, especially in hockey. A study performed by Dr. Michael Cusimano at St. Michael's Hospital of Toronto discovered that 44% of youth athletes that have suffered a concussion occurred during hockey. I will now show a short video just explaining of what a concussion is and how they can occur.
A concussion is a type of traumatic brain injury, or TBI, caused by a bump, blow, or jolt to the head, or by a hit to the body that causes your head and brain to move rapidly back and forth. This sudden movement can literally cause the brain to bounce around or twist in the skull, stretching and damaging the brain cells and creating chemical changes in the brain. What you might not know is that these chemical changes make the brain more sensitive to any increased stress or injury until it fully recovers.
There it is. That's probably the simplest explanation of a concussion. Like I said, it is a very severe injury and can be very traumatic. It can be a very scary thing to happen if you are a parent of a child who suffered one. Seeing your kid laying on the ice unconscious, that could be a very scary thought. Some signs and symptoms to look for in a concussion that maybe you've seen your child or a friend suffer a blow to a head during a game. Just look for these things just to be sure that they're okay. Some signs and symptoms would be loss of consciousness, disorientation, incoherent speech, confusion, memory loss. These are things to watch for if you think you notice someone who may have suffered a concussion during the game. Maybe you're aware that you suffered a blow to the head that nobody else noticed during your game, or maybe you hit the boards really hard. Some things to look out for. Well, first of all, you should be telling your parents or your coaches that you suffered a blow. And secondly, you can always look for symptoms in yourself that you may notice, such as headache or dizziness, difficulty concentrating, maybe your eyes are sensitive to light, you could hear a ringing in your ears, you could be vomiting, or you could also feel very tired for days after the blow occurred. There are many more signs and symptoms for someone who suffered a concussion, but these are the most common and easy to detect. Concussions will never not occur in hockey. Hockey is a very fast, physical sport, which at some levels can be full contact with body checking. So, players should know that their risk is high of suffering a concussion while playing. Although, there are very many ways to prevent the likelihood of one occurring. A simple way of doing this is by purchasing a helmet that is CSA approved and HECC certified. The CSA and HECC stickers are located at the back of the helmet. The CSA sticker is located on the left back side. It shows the CSA logo with the year the helmet was manufactured. Never purchase a helmet that is not manufactured within the last year. The HECC sticker is located on the right back side of the helmet. This shows the date of expiry. Never ever use a helmet that has exceeded its date of expiry. When this date occurs, you should always be purchasing a new helmet. For very frequent hockey players, they should almost be cutting the time of expiry in half. The CSA and HEC stickers on the back of the helmets are mandatory in minor hockey. Referees will eject you from the game if a player is wearing a helmet without these. That is a step Hockey Canada has taken forward into preventing concussions. Another simple way of preventing concussions is to wear the cage and to ensure all three loops are fastened properly. There are two loops at the side, and there's a chin strap at the bottom. Ensuring the chin strap is done up tight will ensure your helmet will not come off during play. In some junior levels of hockey, the players do have the option to wear the half visor. This is very unrecommended, as it does very much increase your likelihood of suffering a concussion, as the helmet can very easily be dislodged and you could suffer a blow to your head while the helmet is off. Playing safe and playing smart are two very important precautions to take when playing any level of hockey, especially contact. Checks to the head.
Knocked off his stick, and then Torres explodes up into him, and he's off his feet as contact is.
And checking from behind.
Hit the edge of the board, certainly a vulnerable position there.
Are two very common ways to suffer from a concussion. Ways to very simply avoid this are easily just to keep your head up and be aware of the play around you. Oftentimes, players will blindside other players with head checks. Or, instead of picking the puck up with your head down like this, going into the boards, facing the boards. That is possibly one of the worst plays you can do because you will almost always be checked from behind. Simply just make that turn and put your shoulder towards the board, so you're landing shoulder first into the boards. These precautions will save you from concussions. Also, play clean. Often when players run around like idiots trying to hurt the other team will respond to that and they will target you. Often players who are very, very dirty players are the ones who suffer concussions because the other team gets frustrated and then attempts to injure that player. Like I said before, concussions are very, very serious and should be never treated lightly. This is a very serious issue which parents and players should be very aware of. Thank you.